What is a medical emergency? According to the College of Dental Surgeons of British Columbia, dental emergencies can have many causes, including accidents, sport-related injuries, tooth decay, and infection. This may include a traumatic injury during the procedure, severe pain, uncontrolled bleeding, stroke, syncope, and shock. Therefore, before starting any treatment, CDAs must update the health history by asking questions regarding a change in the patient's overall health. Taking all 4 vital signs will prevent undesirable emergencies and ensure the patient's comfort and safety. Best practices may include scheduling morning appointments, depending on the patient's health history, ensuring the patient has slept well, ate, and taking any medications needed prior to the appointment. Finally, always have your emergency kit close by and ready to use. This includes a defibrillator, nitroglycerine, aspirin, inhalers, oxygen, and of course the emergency contact numbers.
So now, let's talk about our medical emergency. Dr. Camosun is halfway through a crown preparation for Miss Leon. The dental team is using a dam and a bite block to help for Miss Leon's sore jaw. The CDA noticed that Miss Leon starts to tremble and her skin is moist and pale. When asked if everything is feeling okay for her during the procedure, it is hard to hear her answer. The CDA removes the rubber dam and the bite block. Ms. Leon is still unable to give the dental assistant a coherent answer. So the first thing we're going to do is take a look to the health history. She is 63 years old and has reported allergies to sulfate and latex. She also reported that she suffers from diabetes and high or low pressure. Finally, she reported she's under antidepressant medication.
So, according to the facts, what medical emergency is occurring? We'll say it can result in syncope. Now, the cause may be related to high or low blood pressure, diabetes, or possible antidepressant medication use. The health history does not specify if she has high or low blood pressure, and the patient is not able to respond, so we'll say she has low blood pressure because she has moist skin and is trembling. If the cause is her diabetes, we don't know if she's type 1 or type 2. We'll say that she's going into hypoglycemic shock with a lack of sugar in her body before the treatment. Finally, some antidepressant medications may trigger syncope due to the use of anesthesia containing vasoconstrictors, but the health history does not offer much information about it. In these cases, we can find possible cause, but we can't confirm just one. Either way, our job is not to diagnose, but to act, and that's why we must attend the emergency now. First, we'll begin monitoring vital signs to be sure that the client is okay and within the correct levels of temperature, pulse, blood pressure, and respiration. Now, because our patient is trembling and is not able to give an answer, we should position her in the subsupine position to ensure blood flow back to the brain. Because we are not yet sure if this is hypoglycemic shock, we will try giving her some sugary foods or glucose to discard any issue related with diabetes. Finally, if the emergency persists or gets worse, call for emergency help immediately.
The role of dental team members. According to the College of Dental Surgeons, dentists should have strict and clear protocols in order to be followed by all staff in an office. CDAs and hygienists may support the emergency by retrieving the medical emergency kit, alerting staff, and practicing basic life support skills with the dentist, while receptionists and others in the office will be made aware of the situation and call 911 if necessary. The best case scenario for Mrs. Leon would be that the medical emergency is recognized by staff and treated accordingly. The worst case scenario for Mrs. Leon is that if we do not act fast enough or treat her emergency adequately, she could have a seizure and or lose consciousness while awaiting medical care, possibly resulting in hospitalization for a duration of time. Luckily, in a well-knowledged working environment, the cooperation and initiative of every member of the dental team will treat the medical emergency successfully.